call the meeting to order tonight. I'd like to welcome each and every one of you to come out and be with us tonight. And we're here at the Historic Carson House, and I think Chuck's going to maybe just go inside on it after a while and some of the historical days of the wonderful place. But we're happy to be here, and we will go ahead and proceed with our meeting. First thing we do, as always, we'll start our meeting out with a prayer and a pledge. And Commissioner Allison's going to lead us in prayer, and Commissioner Walker will lead us in the pledge.
Let us pray. Dear God, thank you for allowing us to be here today, and we just ask for your guidance and direction in all the decisions that we make to help the people of McDowell County and help our citizens. And we just ask for that guidance today. We just ask for that hedge of protection around our people to keep them safe. And ask you just to be with everyone today. In Jesus' name, amen.
Attention, salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mayor, motion to approve minutes.
So moved.
Motion second. Any discussion? All in favor say aye.
Aye.
Any opposed? Need approval for the agenda tonight. Everyone's had a chance to look at it, I think.
So moved.
Second.
Motion is second. Any discussion? All in favor say aye.
Aye.
First on the agenda tonight under appointments is our flash flood event update. The code update from Mr. William Kehler. And William, we'll turn the podium over to you, my friend.
Mr. Chairman, Commissioners, thanks for the opportunity to provide an update. As you know, Thursday, October 7th, McDowell County experienced another flash flood event. Over 110 storm-related calls were processed in our 911 center in a short period of time. After 7 inches of rainfall fell in a number of areas across McDowell during the Thursday morning commute, tracking some drivers and requiring multiple water rescues. Partnership exhibited on Thursday between Fire Rescue, EMS, the 911 Center, law enforcement personnel, and others allowed us to report back 0 fatalities and 0 injuries due to this flash flood event, but unfortunately it left behind considerable damage. Early indications indicate that the damage to private as well as public property is in excess of $1 million. As of this afternoon, over 70 damage reports have been filed with our office, with most of these either receiving a site visit or a phone follow-up by one of the members of our staff, and that has been already taking place. Most of the damage that we have seen is directly tied to private bridges, driveways, culverts, and private property. We have 4 residential structures that suffered water damage, and we have 3 vehicles that were totaled in the flood waters. Emergency services installed 3 footbridges on Friday afternoon to allow citizens that were isolated from primary roads. We installed these footbridges, portable footbridges, to allow them access into the residents. And we continue to conduct damage assessment in conjunction with the county representatives, the city of Marion, and the town of Old Fort. I think it's important that we go back over as many disasters that we've had since 2018. This disaster alone is going to bring up additional questions about private roads, bridges, and driveways, which the majority of our damage is pointed in that direction. We have a number of people that have suffered losses, $25,000 to $50,000 by the bridge being destroyed or the culvert being washed out, requiring substantial work. For a federal declaration for public assistance, which provides assistance to local governments and governmental agencies, it's also known as PA, the county has to meet a certain threshold. It appears that we have met that threshold. However, North Carolina as a whole, as a state, has to meet a state threshold. And it appears that's where we're going to fall short. But this is very early on in the damage assessment. For governmental agencies, that would push that back to a state disaster declaration. At that point, it's 1% of your operating budget, as the county, we don't have anything close county government-wise. The city of Marion does, and it appears that they have met the threshold for state declaration. The town of Old Fort doesn't appear to have any damages to be declaration. For individual assistance, and this is for our citizens, individual assistance is directly tied and geared towards damages related to primary structures and structural damage to the residential structure, if you will. There is no state or federal program at this time that provides reimbursement or disaster assistance for private bridges, roads, or culverts. This is something that we've been through all the way back to 2018, and I know Chairman Brown and Vice Chair Walker, we went through this a lot after Alberto for people looking for assistance. We're encouraging people, if you do the repairs, make sure you take pictures before, during, and after the repair. Save all of your receipts. In case something is implemented and is retroactive for this disaster, and potentially going back to Tropical Storm Fred that occurred, that hit Haywood County much harder than we saw this last incident. So that's where we're at from an individual assistance standpoint for disaster assistance. We continue to refer individuals who sustained water damage or those that we think could benefit from volunteer organizations. Once again, Grace Community Church has taken the lead on this. In a briefing this afternoon, I was told they've completed 3 referrals already, that we got 2 of them, one being a veteran, another one being an elderly couple that needed immediate assistance. But that's where our office is the conduit to lead these citizens needing help to the volunteer organizations. It is our recommendation that the state of emergency be terminated tomorrow at noon. And just as a recap, our office continues to work recovery efforts from Florence, Michael, Zeta, the flash flood of May of 2020, and then the flash flood that occurred in the spring of this year, along with COVID-19. Before I give the COVID update, I ask if there's any questions related to the storm response. I will mention, and I want a big shout out to our staff at the EOC. Within about 12 hours of this occurring, we had an online portal up and running for people to report damage assessment to. We implemented the disaster or the damage hotline on Friday, actually Thursday afternoon. Days are running together. I hate to say that I never want to see these floods, but if we've learned from each one that we've been through, this allowed us to turn that on very rapidly and get people a way to report the damage.
I've got a couple questions. One was there, I haven't heard certainly, I think we've heard if there were any deaths, but there wasn't any deaths, so were there any injuries?
There were no deaths and no injuries. We had a number of motor vehicle crashes that occurred that had some injuries, but as far as actually storm-related, people in the water, people being hit by debris, we did not have any reported injuries.
The second question was water rescue. Did you have to do quite a bit of that?
There were numerous water rescues, and if you looked at any of the pictures that came in Thursday, there was water in places that I've never seen water flood, or roadways that we've never had issues with. And a lot of it was caused by debris that blocked culverts and the major drains, so forth, that caused 3 to 4 feet of water in some of the places. But we had several structures that had water come in that was waist high.
Well, I'd just like to express our thanks again for the good work that you guys stood up and took charge and done a great job during this crisis.
We appreciate that. It was definitely a team effort by all the emergency agencies in the county. Any other storm related? We'll move on to the COVID-19 incident. Today's day 574 that the Emergency Operations Center has been activated for COVID-19. I'm happy to report we have very encouraging trends that are present in our metrics, across most of our metrics. While our case count is really way too high for where it needs to be, and McDowell remains at the top of new cases per 100,000 population. We've been at the top for a couple weeks now. We definitely want to see this come down. We are seeing encouraging trends in the metrics. Today reports 56 new positives, 2 additional deaths. Since the last time I give a full COVID-19 update at the September board meeting, 26 citizens have lost their life due to COVID-19. Our 14-day positivity rate is 19.3%. This is the first time since July that we've seen it under 20%. Our 7-day rolling average is steadily decreasing. Last week we averaged 26 new cases per day. 1 week prior to that was 38 cases, and 1 month ago we were averaging 58 cases a day. So we are seeing a steady decline. We're seeing decreasing trends across all age groups, with the exception of 50 to 64 years of age, where we continue to average 40 new cases per week. These cases here are what continues to drive our hospitalizations, and we still have capacity issues within the healthcare system. Our last diversion request from the hospital was on Saturday afternoon when they requested a full diversion, meaning they requested no ambulances come to McDowell Hospital for a period of time.
How long was that period of time, Lee?
I would have to go back and check, but I think it was probably around 2 hours. We did a partial diversion during that time, and last week we saw 3 requests for diversion from the local hospital. This continues to drive the deaths related to COVID-19, and as we know, the lagging indicator after a surge is our death count. We reported 2 new deaths today. When we're talking about our hospitalizations and our deaths, we do anticipate, unfortunately, additional deaths to be reported as we are currently investigating additional deaths, but also we have some extremely sick people still within our community. Our long-term care facilities continue to battle outbreaks. As of today, we have 6 facilities that are in outbreak status, requiring constant coordination with our EOC liaison, who is Shannon Jones from DSS. Some of the summaries of these: Autumn Care, 7 staff, 10 residents; Deer Park, 15 staff, 4 residents; McDowell Assisted Living, 5 staff, 21 residents; Cedarbrook, 7 staff; Lake James Lodge, 3 staff, 9 residents. And the outbreak that continues to grow on us is the McDowell House with 2 staff and 15 residents. One change in our testing strategy will be the health department, the drive-through testing site. Today was the last day for that testing site, as Andrew Labs has expanded testing hours. They are now in the Lady Marion Plaza, Monday through Thursday, 9 a.m. to 6 p.m. It is a drive-through setup. It is free of charge if you're uninsured, and then they're there on Fridays from 9 to 5. So we have a lot of testing capacity now within the community. On the vaccine front, we continue doing the 2 vaccine clinics each week, and we're awaiting the additional guidance for Pfizer to be administered to younger children, as well as the boosters for Moderna and Johnson & Johnson. It's an abbreviated COVID-19 report. I've got the metrics here with me if you have any specific questions, but that's an overview of where we're at and the direction that we're trending in.
Mr. Carroll, what would you attribute to the decrease in the new COVID cases?
So I think it's something that we've seen throughout the state. I think we're all scratching our head trying to figure out why we are slower to come down than some of the surrounding communities that have even a lower vaccination rate than what we do. We have seen our vaccination rate tick up. We gained another percentage point today. We're 58% fully vaccinated and 58% partially vaccinated, 54% fully vaccinated. Some of the things that are in our favor is, number one, we have seen, I think, improved mask compliance in a number of locations. That any type of mitigation strategy is going to help push it down, uptick in vaccination status. And then I think there's been a heightened awareness of how dangerous the Delta variant is and the lives that it's took within this community. young lives that it's took within this community, for people to have a more awareness of what the Delta variant is capable of doing. This is something we're cautiously optimistic, and as I've said for months now, while we are still battling capacity issues, we're still battling hospitalizations, and we're still seeing very sick individuals at EMS. Our case counts are coming down and trending in the right direction, but we know from what we saw last year, the onset of cold weather drove our daily case rates up, and that started last year at the beginning of October. We haven't seen that yet, and hopefully we'll take advantage of the warm weather and it will continue to push down. We need to get as close to baseline as we can prior to the holidays.
I'd like to ask you, William, and I know I know what your answer will be, but just for the record, what will slow this thing down or stop this virus?
Vaccinations.
Vaccinations. Okay.
I'll do a follow-up question too. I'll do a question and statement. So the statement will be this. People say that we are requiring people to be vaccinated. I've heard that. The Board of Commissioners has not required anyone to be vaccinated. We encourage people to be vaccinated strongly. It's for their own protection. So I think that's important to note for the record. I know one commissioner told me today that he was told that we are requiring people to be vaccinated, so I'll clear the record up today and say we strongly encourage everyone to be vaccinated. But the board has not made the mandatory requirements of county staff stating you must be vaccinated or you will lose your job. So make sure everybody was aware of that. And William, I know that 58% people of the county are fully vaccinated now. What is the ideal? I know, as Tony stated, ideally everybody would be vaccinated would be great. But what is a realistic number that you as staff think that we can obtain that would be, as Tony said, beneficial to slow this thing down?
I think our first target is the 70% range. I think that's where a lot of folks, but ideally that's just a starting point. I mean, if we're ever going to put this thing behind us, we have got to get the vaccination rate up, and that's, I wish, and I've carried this message many times, for people that have questions about whether they should be vaccinated, ask your physician. If you trusted your physician for 30 years to take care of you when you're sick, trust your physician now to give you guidance when we're facing a pandemic. If someone was to follow us and see what we have witnessed at EMS during this pandemic, and the people that have been struggling to breathe, don't wait until it's too late. Make the decision based upon good information. Talk to your physician, and then make the determination. We've made vaccines as easily accessible in this community as we can do.
I can, of course, I speak from first-hand experience, but if you want to know what it feels like, hold your hand over your mouth and try to breathe. It's terrible. You don't want to.
We don't have any way of tracking how many people have actually had the flu vaccination. It seems that people trust that, but they don't trust the COVID vaccination. And to me, it's one and the same. You know, a vaccination to prevent something that could take your life goes to both.
That would be a question that I have to defer to the health department, because I'm just not sure on that tracking, since we've never been involved with that.
And one follow-up question too, how many people have been transported to the hospital because they have had an adverse reaction to a vaccination shot here in McDowell County?
None that I'm aware of. Before I gave you an absolute zero answer, I would want to make sure my answer is correct, but none that I'm aware of.
People that have had COVID and not vaccinated, is your recommendation for them to get vaccinated after a certain period of time?
Yeah, so the CDC's got specific guidance on if you've had COVID and waiting a period of time after you get vaccinated. And then we also we'll, at the vaccine clinic, encourage folks, talk to your physician. Some people's recovery period is different. Not everyone recovers within 14 or 30 days. And have that conversation and get the recommendation from your doctor of when they think you should have it after you've got COVID.
Hey, any other questions?
Mr. Chairman, I do want to, this is not a question, but this is a statement. I talked to several board members, I think, and county manager. I do want staff and the board to consider having a ceremony. I know we all have people that we know, friends or family members, somebody you go to church with whose lives have been affected by COVID and they've lost a loved one. And I think it'd be just, I don't want to forget those people. As a commissioner, I want to make sure that we remember them in some manner as a governing body in this county. And I would like to see staff coordinate a service, a ceremony, and we can talk to the mayor and both the town and the city and have them participate, and the board do a resolution just remembering and something that could be done officially and to recognize any people who have lost life due to COVID and have them included if they want to have their names read at a ceremony, and also recognize our staff too who have been on the front lines and have them there too. I think it'd be just something that needs to be done.
Is it a form of motion?
I'll make that in the form of motion that we do that. And also, I would like to see it even go beyond that. I think that COVID's affected the entire nation. And now we have some say in McDowell County as a board, but I want to also, in that motion, I guess, contact Dudley Green and Ralph Pice and the governor's office and request that something be done formally on the state level and have a day set aside to remember these people yearly moving forward.
Okay, we've got a motion, we've got a second. All in favor? Any discussion first? All in favor? Any opposed? Okay, Mr. Wood, will you take care of that, sir?
Is there a preference on the dates or come back maybe next month for the date?
Staff give recommendation.
Okay.
I think that'd be really good.
Yes, sir.
Good thought. Thank you, Mr. Keller. Next on the agenda is the planning department update. We've got Mr. Ron Harmon here with us tonight, so Ron, the floor is yours.
Thank you, sir. Planning board with Chapter 160B of the General Statute has updated the planning board ordinance. And in doing so, we found out that the makeup of the planning board ordinance also institutes the Board of Adjustment, which is no longer a function of the planning board. So we're asking to strike that section out of the ordinance. It also has 9 members and 2 alternate members. And we're asking that the alternate members either be removed or be renamed full members to clear up confusion with the planning board ordinance itself.
That's something that needs some discussion.
If I may, you've got
Yes.
those requested changes in your ordinance, and you don't have a policy necessarily on ordinances, or in this instance, there's not a law that requires you to have a first and second reading. But it is an ordinance change, and I know staff would have no problem. I don't think the planning board would either. If you wanted to let this sink in and read it and think about it, get whatever feedback for next month, if you wanted to.
So this will be a first reading then?
Yeah.
So I can make a motion to table it till the next meeting.
And then if you had any, sorry.
I'll make that motion.
Okay, I've got a motion second on that. Any other discussion? All in favor of that, say aye. Aye. Any opposed? Okay.
The second item I'm here for is to ask that the subdivision numbers for major and minor be changed. Currently in McDowell County, a minor subdivision is anything up to 20 lots, and that is a staff approval. With the amount of development we've got going on, staff would like to see that number reduced to 10, and anything 11 and over be a major subdivision and require planning board approval, which would require a meeting before the board and more eyes to look at the development.
I'll make a motion to approve as requested. The 10 lots and plus is minor and 11 lots or more is major.
The motion,
Second.
second, any discussion?
Can I, sir, that does require a hearing, so that would fall under legally at first reading. If that was maybe changed to have that hearing set for next month.
Yes.
I'm in second.
What would be the option for people that have already got some already started? How would you handle that?
The way we handled it in the beginning of the ordinance is you could put a time limit, 6 months, 9 months, and say you can show your due diligence on a day on the plat that you were in progress prior to this change, and we'll accept it. That would be up to the board, your decision, or you could ask the planning board to study that and look and see if we can find something else.
Do we make a recommendation on the hearing next month when that's done at that point? And talk about the timing?
Yeah, it just wouldn't be retroactive to those that have already submitted the request.
Correct.
That's good, then we'll just,
I think you need a vote on setting that hearing.
okay, we have a motion and a second on that. Is there any other discussion on this? All in favor, say aye.
Aye.
Any opposed?
Mr. Chairman, maybe to save Mr. Harmon, unless you wanted to stay all the meeting, I don't know, but under board appointments, there's a planning board, actually 2 seats up for appointment, and there are some suggested changes in the seat count. So I might want to recommend tabling any appointments to that board subject to the change
Based
next
on what
month.
we just voted on, we'll do,
Yeah, I'll make that motion.
a motion.
To table it
Table.
until further discussion.
We got a motion and a second to any other discussion. All in favor, say aye.
Aye.
Any opposed? Thank you, Mr. Harmon.
Thank you.
We've got, next on the agenda, item C is Gateway Housing update. We have Neil Gurney here with us. Welcome, Neil.
Hi, Mr. Chairman, thank you very much. It's nice to see you guys again.
Nice to see you again.
I've been great. It's been a little over a year ago, I think, since I kind of looked up before you the last time. And so much has changed. So I thought we would do a little bit of updates generally, and then I wanted to speak about home repair, which is something that's started up. An update on the project where we first met at McDowell County, at McDowell Tech. I've included in your, hopefully either sent to or otherwise a follow along, because when I first arrived in America 20 years ago now, my lady worked for me, and for the first 3 months, she agreed with everything I said. And when I finally asked her and said, how come you agree? She said, I don't know what you're saying. You're asking too bad. So I just nod yes all the time. So rather than just nod yes, I thought it was something to follow along. We literally do, Gateway do literally exist for one reason only, and we exist to bring money into the county. That is why we're here. That's a quick summary of long mission statements and all kinds of things that organizations put together, but we're here to bring more money into the county. And we do that in 3 ways. The first way is our own grants program, which is just finished. We do that in August every year, and we'll always do a grants program every single year in August. The second is the leverage fund, and I'll speak a little bit more about that in a second as to what that is and how that works. And the last is strategic partnership, where we partner with the county and the city and other nonprofits to do large projects like the one at McDowell Tech. So those are the 3 main ways we bring money in. Let's start with the programs piece first, or the grants program first. That's an annual program. Any nonprofit in the county can apply. As I said, we just finished that session now. We haven't announced those awards yet. We'll be announcing in 2 weeks' time. We have a final board meeting a week from today, and when that board finally meets, we'll announce those. But in the past, we've done Foothills Food Hub, both infrastructure, help building part of the food hub, and then COVID-19, we funded a huge amount of money towards that, plus got the community involved in actually funding actual food during the COVID time. McDowell EMS with Will Kehler and team, the community paramedics, we added an additional person on there. It's the 2nd year of funding that's been awarded up till now. And it was to increase the after hours and weekend use of community paramedics during that time. McDowell Schools, very involved with bringing in on the elementary school side, We brought in a counselor and a coordinator looking at kids at risk and recognizing that you need to get them at elementary school. At high school, it's sometimes too late, although there's a counselor at high school. We introduced a counselor at elementary school stage to keep doing that. And we've got some great programs we want to do with them. Just to summarize on others, McDowell Mission Ministries, most of you know, we've been with them. Kennett Counseling, we've helped. Foothills Food District, Foothills Health, we've helped. Center for Rural Health Innovation, which is telemedicine to schools, we've funded that. Centro Unido, we funded this year for the first time. They had a community health worker in the area for the Latinx community. We funded that. West Marion Community Forum, reaching out to African American communities, very socially funded programs with them as well. If you move on to the next page, we talk about leverage funds. So that's our general gateway funding program. The leverage fund is a very interesting one. We actually assist other nonprofits to get funds. There's a lot of money on the table. About 11% of actual funding comes to Western North Carolina of what is available state and federal. Percentage-wise, it should be 18%. That's the percentage ratio that we are. We're losing about 8 or 9% of federal and state funding for two reasons. The organizations don't have the ability to ask. They don't have somebody to write the grant for them. And the second is they don't actually ask. They just forget to ask. It just passes them by. They don't know about it. So we do two things. We pay for professional grant writers. Gogwood partners with us, and we pay for a grant writer to write. Certain grant writers write exceptionally well on certain kinds of grants, and we pay that grant writer to do that. Organization has no cost at all. We just physically pay for the grant writer, find them and connect with them. And secondly, we write grants for them as well. We at Gateway do grant writing as well. So those are the two ways we actually manage the leverage fund. Today, $3.5 million to McDowell County has come in that didn't exist previously through the grants program. And this is large in a couple of areas. You can see McDowell take as a favorite of ours. They work very well with us and they help us. Grants are interesting. You've got to find somebody on the recipient side who's prepared to help you get that grant because there's a lot of work they have to do. We can bring the grant writer in, but they have a fair amount of work to do. So McDowell take the Old Fort campus. We helped pull that together for them. It was an $800,000 grant. The most recent one, $2.4 million, was the Improving Low-Income Student Success Rates. There's a large program around that. What I'm probably the happiest about is McDowell Tech is starting up a construction trade skills course next year. We're going to partner with them where we're building houses in certain areas. And we're going to be actually having them as interns. We've got money for them to be paid interns as well. At the college project, they can intern on the college project. So we've got a link to that. They're actually training the students to do that work, and they'll come out with an actual qualification. COVID response, various grants, and then the most recent was home repair, where we actually got various grants, and I'm going to go into that in a lot more detail. So if you hit the next page, home repair, about 71% of McDowell residents actually live in houses. They actually own their own house, which is fairly high in the county, in counties in general. Most counties aren't as high as that. So we have a lot of people that have their houses, probably because of coming from the mill era where people got houses and moved into them, they still own their homes. But about 50% of those houses are well over 50 years old. I mean, in the 60s and 70-year-old, we see a lot of dilapidated and falling down houses out there. And then about almost 4,000 McDowell County residents can't afford to pay for the rental. It's basically 30% of what your income is what you should be paying on rental or on your mortgage. And about 4,000 people fall into that category. All of this comes together to say there's a lot of houses in bad shape with nobody able to fix them. And what we realized sort of earlier this year was that there's money on the table for this. North Carolina Housing Finance Agency provides $100,000 to the county per year. McDowell has never received that money. Nobody was asking for it. The Dogwood Foundation provides $50,000 a year to the county. Nobody was asking for it. And then Bridge Foundation had stepped in the middle of that. They were looking for somebody to fund. And that's what really started the program. We said, well, okay, if you're looking for somebody to fund, we'll start it up. And so we had to start a home repair program from scratch in order to get this funding going. And so was born the sort of home repair partnership program. Like all things that I find in McDowell County, it really is the people that come together. It's amazing how the communities, the churches, the commissioners, the town, they all get together and help us. We literally call a meeting of everyone together, from planning board people to everyone involved, multiple churches. We now have 18 churches involved in this program. And they really became the contractors. You heard just now, Grace Community are working on various things. Grace said, we do a lot of roofs. If you can help fund it, we'll do more roofs. Pleasant Garden said, well, we did a lot of ramps, if we can help fund ramps, we'll do more ramps. And so it went on. And we ended up with 18 churches and 2 community organizations that jump in and volunteer. We couldn't pay for some of these directly. We don't have, if there's no volunteer, it's an electrical problem and we have to have somebody, a qualified electrician, we can pay for it. But we double the amount of money by getting volunteers. We can get a volunteer to do it. All we do is pay for the materials. So we're literally doubling that money at the same time. Overall, about $200,000 that is coming to this county. Started this year, actually went live in June, and $200,000 will take us into next year with programs just on home repair, urgent home repair is what we call it. This is somebody who really is in a situation financially can't afford it to do something and have urgent home repair. I've listed who's funded it. There's 4 different organizations that funded that. And next year, in January, we'll be applying for the state funding that we didn't get this year, the $100,000, which we'll now qualify for because we have a home repair program. They wouldn't allow us, we spoke to the state in January, and they wouldn't allow us to apply because there was no organization to receive it. So that's how this all sort of gave birth to the program. We started in June, as I said. I said there are 30 applications thanks to McDowell News, and their report last week, we now have 50 applications in play, and the word is getting out there very quickly. So we have 50 applications busy being processed at the moment. 30 of them have already gone through. Eight of these projects have been completed, and we're working to relocate 3 residents. Sometimes the house is just in such really awful shape. There's nothing you can do. It would cost us, we have a limit of $10,000 a house that the grant allows us to do. And when nothing can be done at that point. And we've worked with 3 residents who said they'll relocate, we can help find them somewhere else to live. And we work, again, through the church has been, Nebo Crossing, in fact, helped do the relocation program for us and try and find them accommodation somewhere else. The 2 pictures you got, the one on the left is actually it's an old school way of putting in a drain field. We couldn't find any those pebble pipes that if you do plumbing, you need sort of a pebble pipe, but a pipe with sort of polystyrene pebbles around it for a drain field. Not available anywhere, not anywhere in the country. So they went back to the old school way where they put the pipes down, they put gravel down, put the pipes and throw gravel on top, and that's actually a drain field being done for a homeowner who's had no sewer running because of the drain field. The one on the right is actually a Pleasant Gardens and a ramp for a homeowner in the area. And sorry, I'm going to jump a page back. I forgot to mention the other 2. The first one on the left is actually a roof being redone in an old fort. That's Drexel Community Church busy putting on a new roof. They interestingly do metal roofs because they last longer and they're much more durable, and you can put them onto almost any surface because when roofs get old, they bow like this and the metal roof just creates a flat roof right across there. And again, a Pleasant Gardens picture of them. The Pleasant Gardens seems amazing. They've been going for a while, sitting out there in the middle of a cold anything, they just build a ramp. So that's the home repair program, up and rolling. We'll take any request for any home repair, including the floods. If people have home repair, but it has to be the house. We can't do culverts, can't do bridges with the home repair money. I actually asked me this weekend, I checked with the different organizations that are funding it. It has to be the physical house itself. But I'm sure there's a lot of people that have issues around that with their homes. If the home is in need of repair because of the flooding, and that fits into that category, and they fit into the income category, well, I happily take that application. So it doesn't stop. There's money available for at least 18 months worth of home repairs. All right, next one is McDowell, the housing project. This was the one I first met all of you, and we couldn't believe, I think Sarah Grimes, who's now Dogwood, said she couldn't believe the county and the city and the college were all working together with everyone else and how a community comes together. And that is what I have found everywhere, including the home repair project. This is the 168 units in College Drive, rental workforce units that are underway. Will be getting underway, let me rephrase that. Quick updates. There has been unwavering commitment from Dogwood, from ourselves, from Housing Assistance Corporation, from you as the commissioners, from the city to help us. In fact, during this time, a lot of support that you've given us. There was 2,000 cubic yards of soil we need moved, and you guys are helping us do that. And essentially what happened, because of the soaring prices in everything, we started looking at the only way to make this work is, can we cut the prices anywhere, and can we up the rentals? And those are the 2 criteria that we've been trying to deal with. We've worked with partners everywhere, including the commissioners here have helped. You helped us with some of the cutting of the costs. The town has as well. And at the moment, there's a market study underway. This is the only thing holding up pressing the final button, the market study underway, to see what rentals we can go up to. HUD has actually said the rentals were too low. We were at $890 and $780 and $880. Rentals, they've said we can be at least $15 to $20, maybe $50 more. If that rental comes back on 168 units, that makes a huge difference to the overall amount. Within 2 to 3 weeks, I'll know. We'll definitely go ahead. It's when we're going to go ahead. It's just, can we get the numbers to juggle correctly? Lumber came down, but plumbing went up, and so did concrete go up, so you're playing one against the other all the time. It's a strange world we're in at the moment, and you can't get supplies. It will happen. I'm hoping that, I would almost say definitely that within the next 2 weeks we've got to go ahead to move ahead with the project. Everything's working towards that. Soil tests have been done, we've been moving ahead. Not a lot of rock, which was the one big indication we were looking for. That's helped again because it would cost a lot of extra money if there was rock. So we know there's no additional cost because of rock. So the soil tests are completed, and they're, on the page after, I'll show you some preliminary designs. They've started getting the engineer involved. This is again all Dogwood have paid for an engineer to come in, start the preliminary design, start that. So when it goes to HUD, we've got that all done. That's the next step that HUD requires to do. The next phase is where there'll be a final HUD application, which will go in hopefully in November. HUD gets 60 days to approve that. Then it comes back for review, then it goes back to HUD again for the last time. My guess, Chuck was asking me a minute ago, probably April, May is when we'll break ground on that project. With the HUD process going down. So we've moved as fast as we can with everything, and again, appreciate everything you guys have done to help us get to that point. And my last and final slide is just we have a house arriving. We kept going. We have a house arriving in West Marion, thanks to the city who donated us a piece of land. We've got a house that's it's a modular. It's going to be arriving on the 28th of this month. A large part of our home repair program, a large part of our home affordability program we've realized is that we can get people, we have a member on our team who's qualified as USDA loan officer. We can get people into a house at $650 a month, a 1,200 square foot, 3-bedroom, 2-bathroom house at $650 a month for a USDA loan program. You have no down payments. We counsel them into the program, and we'll build them a house. We've 7 or 8 different designs that we can build for them at the stage again. It was our trial run that we did with the city, and it's working out very well. Bottom line is, you earn $12.50 an hour or more, you can get into your own house cheaper than you can get into rentals at the stage again. We're going to do more of this. I'm actually meeting with Chuck and a few of the team members and Helicopter and others to see what space we can find. But it's a very easy and very good program. We've got a large piece of this running in Rotary County. We'd like to do the same thing over there. So watch that space. Therell be more to come on single-family homes as well in this area.
How many, right here on the single-family residences, how many is Gateway looking to do in McDowell County? Just based on the availability of the resources as far as the land goes?
Yeah, we'd love to. In Rutherford County, we've managed to get 15 acres, and we're doing, on 10 of those acres, we're doing 34 single-family homes. We'd love to do 30 to 50 single-family homes. There's a large study coming out from Dogwood very soon, by the end of September or October, which they'll actually pinpoint how many houses are needed in each area, and we'll be able to give you an exact number for this county. As soon as I get that study, I'll pass it along to you. But they actually they commissioned, because we kept asking them the same question, is how many do we need to build? How many units do you need? They've commissioned a nationwide or a regional-wide study to actually pull that information out. But we could easily do 50, we know at the moment, without any problem. In Rutherford County, we've got 34. They break ground, in fact, next month in November. And we'll be putting in roads and water and sewer infrastructure, and then start building houses about March. And we're going to do 10 to 15 a year for 3 years. We'd love to do the same. We will do the same. It's not love to. We'll just a matter of finding a piece of land. And we can also do areas where it's septic and well, but you can't get as many per acre. So water and sewer is a big key part of that. Last but not least, I sort of did a quick summary. We took everything we've done in those 3 categories: our grants, our leverage fund, the rest. It's about $25 million at this stage of the game since we first arrived here. I've been here, in fact, October is my second year here. And since I first probably spoke to you guys, that's where we're sitting as financial impact into this county through the work that we've been doing. Any questions?
$5 million investment into this county is very big, and we certainly have this board. We appreciate the Gateway Foundation involved.
Thank you, Jim.
Thank you very much.
We love being here.
Next on the agenda is the McDowell Health Coalition and Housing Project. We've got our dear friend Alex Portelli here with us tonight. So we're looking forward to hear what you've got to say.
Super, thanks. Brenda, Cheryl, gentlemen, thanks for having me tonight. It's actually kind of fun to come in here and dovetail on some of the stuff that Neil is doing. Obviously an issue that we're all struggling with, and the only way to eat an elephant is to take one bite at a time. So Neil's taking a huge chunk out of that elephant, and I'm here tonight to give you an information briefing and an update on some of us that are taking some more bites out of that. It's been an interesting year because of COVID. I'm here tonight as the Rotary rep to the McDowell County Health Coalition. There was a brief hiatus of the Health Coalition for a while with some restructuring, reorganization, some new board development, and you might have noticed over about the last 2 months, thanks in large part to Mike Conley as well as Scott Hollyfield, we're starting to get some traction in the areas we're doing to get out there and let the public know that we're back and playing big time. As a reminder for you and the people here in the audience, the mission of the coalition is to connect, convene, collaborate, and create opportunities for whole person health in McDowell County. The vision is a healthy McDowell County where people have the ability to thrive. And much like Neil alluded to, I think at our last large meeting before COVID, we had about 45 representatives around the table covering everything, all the community for KULA, the Food Advisory Council, you name it. And we're all doing those same kind of things to try to, not really stovepipe, but get together to figure out who can lead what and who can do what as part of the coalition. Avoid the duplication of effort and mismanagement or misuse of funds and whatnot. So as we redid that with Kobe actually, and Y Director is our chair, we said, what do we really need to do? So from a whole standpoint, and as a coalition, if you take that vision statement, that mission statement down, we said what it really means is that we want to provide for the physical, mental, emotional, and economic health of all county residents. So there's the elephant. And so to slice that up into manageable portions, there are 3 areas that the Health Coalition is right now concentrating on. The first is mental health. I think you've seen some news and media coverage over the last couple of weeks of what we're doing there. Racial equity became a big part. It was an outgrowth above and beyond Black Lives Matter. It was also one of those big standing pieces that in particularly the East and West Marion community forums wanted in, and we thought that's a great area that we can play. They already have resources available to us, and we've been drawing on those and doing those kind of issues. And the one I'm really here to talk about today too is the housing issue, and primarily because I have a wealth of local and national level experience in urban and rural affairs. Kobe asked if I'd head up our housing effort, and instead of screaming and running away from him down the hall, I told him I would do that. So I want to tell you what we've been doing lately. Back in January 2021, we formed a working group, as is our traditional means of doing business, and we created something that we called the McDowell Housing Advisory Network. They love acronyms for some reason here. It became MCHAN. It was easy to do and it separated from the other working groups we have. And we sat down with that working group of originally about 8 to 10 people, and we said, okay, what's the real issue? We recognize that housing affordability, availability, and homelessness issues impact the county, and there was a desire for community solutions to occur. And that's really what's driving this train. We all know that each demographic within McDowell County has different housing needs as well as desires. But it's wonderful as we all throw around these little blurbs. There's like, okay, housing affordability, availability, things like that. They're great. You have some data to use on, but you can't really identify the problem until you know the scope of the problem. And that's what we're trying to start to focus on a bit more. So we felt we had to identify baseline issues and create solutions, find data, and listening to stakeholders is critical because everybody has a little bit different idea of what these different buzzwords mean. And we need a transparent collaboration across the communities because it's transparent to long-term success. And so we came up with the goals that you see on the next slide. Short-term, a countywide survey, electronic, which is actually underway now, and hard copy as we deem it necessary. Midterm, we will follow that up with stakeholder sessions and interviews. We will have a large community meeting to present and discuss the findings that came out of that survey. And the intent is ultimately to begin putting together an information packet Mid to long term, that's a comprehensive statistical and narrative info packet that will be presented to you, as well as all our other public officials within the county, because we can't do this in little separate stovepipes. You need the overarching umbrella for this and the overarching umbrella to do this, no matter where you do it and what type of leadership. It has to be driven from the top down by the volunteers working from the bottom up. So the long term ultimately, as we do this together, and I say together, is if we do this right and build this correctly, we will wind up in the long term with a county housing and housing development policy and a strategy for the out years that will also dovetail and assist in the broader collaboration that's ongoing with the Isothermal Planning and Development Commission, whose next bite, if I remember, is they're going to be working on barriers to developers from developing housing throughout the IPDC area. So before I talk to you about the survey, because that's really the crunch piece I'm here for, I need to tell you a little bit of what's going on behind the scenes, because it's very interesting. The coalition itself, the way I do business, is consensus building, and it's doing everything you can in cooperation. So as we built this survey, some of the stars mysteriously aligned in a positive development. So when we first started the survey, I had originally gone to Heather Cotton at the city, because Heather and I know each other and work fairly well together with that similar urban planning background, mine in Tampa, hers in other places. And we said, okay, who can help me do this so that we can really establish this baseline? And by sheer chance, she had an intern named Catherine Ladner who was helping her. And Catherine and I sat down and we broke out all the work we needed to do for surveys. So we found like counties and demographics. We found 5 different surveys. I went down the hallway of my house, printed them all out, lined them all up. And we did away with all the doubles and came up with a survey. And then turned around and luckily found out Catherine had gotten hired by the county. So I ran in and Catherine and Ron and I got to talk. And it's not like what you can do for me, Ron. It's more like how can we help and establish a baseline. So some of the things we did then was we knew the survey was going to come out, got input on the survey, and then that survey's intent is to create that baseline data collection. It is out there, it is in your packet in a wider collaborative sense. Mr. Garrett, the school soup last week, distributed that using his school network system so he could get it out to as many people as possible. He's probably got to reach in excess of 8,000 people on that system. And as of today, we have 220 responses to that survey alone. 88% are owners, 12% are renters, 87% were female, 13% were male. And when it comes to peer demographics, 95% ID is white, 5% is non-white. That alone pretty much tracks with the demographic, but 225 surveys isn't enough to really answer that on the larger scope that we need if we're looking at 40,000 as a baseline population. So in reality, that survey that we created originally is hard copy with the help of Rural Forward. I'm sure many of you know help us in other areas. They were able to kludge a homeowner survey and a renter survey into an electronic survey. Once you log in, it will direct you in those one of those 2 areas. That helps us build also population demographics, income demographics, things, a lot of what Neil has already discussed, and of course we pull from them as well. I'm hoping that the electronic survey will answer a lot of the mail as opposed to trying to do a hard copy survey. And so I'm going to let that electronic survey go for a little while before we make it. It's much tougher to do hard copy surveys. Got wide support to do that if we need be from the chamber, from the city, you name it, Old Fort as well, to, if need be, put those surveys out in hard copy in places where people can have access to them and fill them out. Traditionally, within the electronic survey, you're lucky if you get a 10 to 12% response. But, now that being said, that survey's out there, and really what we're trying to push and what I could use your support on is this time, Alpo is not asking for money. What I need is buy-in and support from you all. And when I say buy-in and support, I think you see we're all tracking together, which is great. we need to establish that baseline. We need to have those interviews and do those meetings with all the stakeholders, because everybody brings something different to the table. And we need to kludge all of that info together so that we can figure out the next step from the standpoint that the young Chan can go to Ron or to Heather or to the old Fort gang and say, this is what we've done so far to help. Where do we need to help you go next? Because that's what this is. It's collaboration. And if you want to call it, for lack of better terminology, I know personally, Ron and Catherine can't do it all alone. We don't have finite resources. So we're pro bono, 3 extra manpower and worker bees to help do and solve these problems that we're facing. So what I'm really going to ask you all to do is, you have that hot link, and what I'd say is at the personal level, just like all of us are doing, as well as the professional level, help us get that hot link out there. It's really easy. It's 25 questions. And so if we network it through everything that we belong to, like I do it through Rotary, I do it through the Food Advisory Council, but if we can get it out across the board to as many people as we can in McDowell to help bring those survey answers up, we get a better idea of what the true picture is out there. If there is a way as well to get those out, or that survey out somehow on some type of either out on the county webpage, or maybe even, I don't know if we're allowed to do it, but maybe since William is here, if there's a way to get that out over the emergency management system, or even Nextly using the sheriff, because we're all McDowell, is to spread that word. And that's really what we need right now from y'all, is your help. And then ultimately, as always, consensus building, collaboration, total transparency, we can all help answer the mail. We're getting there. 160 units is absolutely fabulous. But I know there were several of us over at the TBA briefing last week, and we want to get ready, market McDowell, get it going, it's really good. Not only for tourism, but we want people like myself that decided to make this county our permanent home. And if we want to do that, we've got to get concurrently moving to go above and beyond 160 units. Or for Chuck, I'm not worried about, having a house, maybe, another group of people that are working at the next McDonald's or whatnot, but I need a half Baxter, which means I need 800 units for economic development when it comes to housing. So that people aren't commuting every day from Tennessee to come down to those great jobs there. That's that long-term vision for growth that we have to have as inhabitants and the leadership of this county to do. And I'm not proselytizing, we all know it. But we have to start, and rather than piecemeal pieces, as we now come together and cooperate on this, we'll get some idea of that bottom line, and we'll get some good direction so that we, as the coalition, can figure out where to plug in and help as we drive that whole vision that we have forward for the county. I'm happy to answer any questions, but please get that link out, and if there's ways that we can figure out how to get that out, above and beyond the school system. I do Facebook, like I said, so whether you're a real estate agent or a banker or whatnot, if you get that out to McDowell peeps, I don't need anybody in New York answering it, but if we can highlight that to McDowell residents, it'll really, really help us grow that baseline data that we need. That as well as we went through the census and all that, as we continue to build, it also helps Neil as we start to justify additional funding that we might want to need, but we have to have hard data for us to be able to do that, just like we've had in the other areas. That's me, that's my pitch. Any questions?
Thank you.
Cool. All right. Well, help us out. Please help us spread the word.
Would you like to respond to that as far as what the county can do on that?
If, without objection, we can do Facebook and website and those sorts of things this week, if you are all okay with it.
Yeah, it's just trying to gather information, so I mean, we're about putting people together and connecting dots, so it sounds good to me.
Yeah. Doesn't cost a dime.
Yeah.
So, yeah, but just let me know how I can help. And Cheryl's got the link and all that. And since we're here, William, I don't know if that's something that we can put out too over the emergency alert network to get out, since it's not really an emergency. But if there's a way we can do that, again, like be a next thing. Anybody here that has any ideas, if you've got one, we get that hot one, get it out to everybody. So, cool.
Good deal. Thank you.
Thanks for your time.
Okay. Next on the agenda was, Chuck Everett was gonna do a presentation. We're gonna move Chuck to the bottom, Chuck, I hope you don't mind, so, we want to make sure you stay here longer. So we are going to old business under item A, the American Rescue Plan update, Mr. Wood.
Sure. What I wanted to do, I mentioned this, I believe, last month, is to start tracking in a template or a document format some of the commitments you've made, some that we have seen from our peers and others, just so you can see as we go along, we're keeping up with things. And so if you look at page 54, I won't go through every single one, but just highlight some of the different initiatives you have put in place or committed to. Like number one is the vaccine incentive. We do have a contingency set up for who knows what at this point for COVID. Physical plant changes, $250,000, for example, set aside for any building improvement projects that might be covered by ARPA. Surge pay you've endorsed. We've talked about the Louder stormwater project. Last month you allocated $3 million, and this is all from the first allocation, by the way. $3 million for the first allocation that's shown here. Stacy Hill Road, we'll talk about in a minute. We have that set aside. And we've also, the last item, we've not talked about it in a while, but talked early on about potentially doing a connectivity grant for low-income homeowners in the Nebo area to connect to the home, to the water system there. So there's $50,000 for that. Most of this that's not already been obligated, I spent, of course, can be adjusted. This is your document more so than is mine, but it's just to put a total there for you. And if you'd like to move anything around at this point or later, that's why we're here. I do have maybe an ask. If there are no questions about this, it's been communicated.
Mr. Chairman, I'll make a motion to the amendment whenever you're ready.
The ask, I passed this out. The sheriff had reached out a couple of weeks ago, and it wasn't in your packet because we were needing to get a little more information. And so it was sort of late coming, but handed you a letter. One of the areas where the sheriff's office, and specifically their jail administrators, really struggle with is when detainees are brought into the facility. Commissioner Vaughn knows this very well. It is very vital that those inmates be searched over and understand, from a safety perspective, but also from a health perspective, who is coming to that facility for all kinds of reasons. But specifically in this day and time, to understand if someone is coming in that might have COVID. And so he has sent a memo to you requesting an investment in technology that would, as someone comes in, it would essentially do a body scan, would also check their body temperature and different, it's not a nurse or anything of that nature, of course, but would scan the detainee and understand if there's some health concerns they should know about right off the bat. And so he has that request. The estimated cost is about $150,000 in that ballpark, with the idea that we could be saving lots of money on the other end for jail medical if something isn't caught on the front end, if that makes sense. So,
Mr. Chairman, I make a motion we take up to the cost when it's bid out to purchase a TEK 84 intercept body scan.
And it may need to be a different, that's an example, may need to be a different piece.
Whatever the final choice is of the sheriff to have that bid out, which is required, and then fund that out of the And that can be funded with the ARPA funds, correct, Ms. Williams?
Yes, sir, based on the information we understand.
All right, and take that out of that $250,000 pot for physical improvements to various county-owned buildings.
Okay, got a motion, got a second, any discussion? All in favor, say aye.
Aye.
Any opposed?
Thank you. That's all I had under
That's all you have in the resolution.
Sheriff, since the county manager is asking for direction in that, in the days to come. Also, under the ARPA funding, there was a $175,000 amount set aside for community economic assistance programs. You know, one thing with COVID, it's been real important for people to be outside. Transmission reduces when people are outside and exercising and that kind of thing. And I know that the board has made a priority to try to make sure that we upgrade our facilities, recreation facilities. And I do know that we're awaiting the governor's signature of the budget, and hopefully we'll obtain funding for the Maple, or for the rec center in the middle of town and do some improvements there. But out of this $175,000, I would like to see a portion of that earmarked, and I would make a motion for $100,000. We talked about a picnic covered area, fenced in with some tables and playground equipment. That's very minimal for parents at Maple Leaf. When they've got a ball game going on up there, you got multiple kids, multiple games. It's hot as can be, and parents and kids are roasting up there in the stands. You know, it's something that I would like to see staff bring back information to the board and get some designs and proposals. First of all, seek grant funding too. Seek grant funding and get a design to bring back to the board.
I'll second that one.
Is the motion to set this money aside at this point?
$100,000.
Staff direction to go ahead and get something back?
$100,000 of the money is set aside in recreation for capital improvements.
and bring back the plan.
Yeah.
Okay.
And by putting in capital improvements, you can use it for anything you need to do, not just specifically that project.
Okay, we've got a motion, we have a second.
Yes.
A second, okay. Any discussion? All in favor say aye.
Aye.
Any opposed? Okay. That's all we have in the American Rescue Plan updates. Item B, the building project update, Mr. Williams.
Yes, sir. I'll move quickly on these. The first item, the administrative offices. As far as we still understand, the upper floor of the North Main Street building will be completed late January, if not middle January. We're still trying to encourage that along, but the material delays are possibly going to put us back there. Do have a potential action item for you if you want to think about it. There's not a huge rush on it. Had heard maybe a request or suggestion that the In God We Trust be placed over the front door on the Main Street side. And so we have a couple of mock-ups in your packet, and if you don't like either one of these, it's not an either or, it's just some suggestions. The first one is just the motto, In God We Trust. The next one has McDowell County Administrative Offices, and then the motto as options in there. So
Like I said, we have administrative offices above the top address.
I agree with Brenda, that looks very professional
and we also have, sorry, the printer didn't catch it, a mock-up for the pedestal sign that would look very nice with the county seal on it and everything. So we'll get that in front of you as well. But, is that a consensus?
Are you wanting action on the tonight?
We'll take a motion if that, to go ahead and get this set.
Is that a
Make a
motion?
motion.
Second.
Got a motion second on the second, any discussion? All in favor say aye.
Aye.
Any opposed? Okay.
Thank you. It's important because this will be there a long time. I will mention just quickly on the other projects, the emergency services headquarters, again, material delays is it's like a broken record, but Mr. DePoyster, Mr. Kehler, and Mr. Presley stay on top of that project as much as they can, as do Mr. Hamrick. The shooting range project also is continuing. Rain like Thursday will definitely put them behind a little bit, but everything held from that event. I have noted that the contractor is having some material issues, of course. One of the major issues he's having is the cost of materials, not so much the supply.
Is that specifically the steel?
The steel very specifically has been an issue for him. I believe 300% price increase from this year to last. And so I think he's looked at all his different vendors and they're all about the same. NC Wildlife is checked. They also buy steel for their sites and they're getting the same scenario. It's just like everything else these days. Pricing is hard to stay fixed.
I'd like to sort of make my comment on that. I'm a retired general contractor, and so I know that business very well. And I do know that, things happen sometimes that you got no control of. And, as the local contractor that's doing this job, unlike many of the larger contractors that you bring in from other parts of the state or out of state to do big jobs for us, it's harder to take a hit for a smaller local contractor than it could be for guys like that. I think my opinion on that is that we should send back to the state. The state, I think this was a 90-10, a 90% state and 10% county. I feel like the county should just step up to that 10%. And try to give them some relief on that because the numbers are there, but he is taking a big hit on it.
Mr. Chairman, I'll make a motion that we have staff contact the state and state that, as you stated, we're in a 90-10 relationship, that the contractor submit the increase of the price that was originally bid versus what it costs now on the steel, which I heard the numbers around $60,000, correct? Roughly.
It's my understanding.
Give or take. So submit to the state that we request them to fund 90% of the overage and we'll fund 10%. And our funding will be contingent upon the state funding 90%.
Got a motion and second on that. Any discussion? All in favor of that, say aye. Aye. Any opposed? Okay, Mr. Whitman.
That's all I have on building projects.
Okay.
EMS building, still on track as far as completion.
End of January, looking at our codes, at the last report was end of January.
Okay, next item, item C, the fire agreement review, Mr. Wood.
Yes, sir. You had a draft of this agreement with the City of Marion in front of you last month. Again, quickly, this is in reference to the Marion Area Fire District, which, if Marion is the center of the donut, this is the donut around the city. And so maybe I'm hungry, but the county has had a relationship with the city as far as supporting the Marion area for many years. And a request was made back in June to Mayor June to update the agreement that was last updated, I believe, 2005. And so what you have is an effort between the city and county to get at a document that reflects your interests as well as the city council's interests. I will note this is not a highlighted version, just a few items of note compared to last month's document that changed. It had been verbalized but not put in the original document, but item number 9, the county agrees to pay for 50% of the total fire department budget. as approved jointly by the county commission and the city council, using fire district tax or county proceeds. And so that was added. Number 11, the county shall approve purchases of equipment when the local funding obligation exceeds $3,000, and they added for any equipment not included in the annual fire department budget that has been approved by the county commission. So not to be repetitive, you've already approved the budget. Why approve it again? I think was the idea. But this is in the event of new grant, new purchase that wasn't originally discussed. Number 12, the phrase, the fire department shall use its best efforts to maintain a minimum public protection classification of 6 for Marion area. Use its best efforts was added. 13 was the inventory that was added. And number 15 was also verbalized before any increase. Fire district taxes approved by the county, the city shall conduct a public hearing and advise the county of all comments by the hearing. So that is in some of the documents, but that was added.
Just the language in this.
I would just like to make sure that we are fully covered on if the fire department's going after some grant money and the grant is not ongoing, and they're going to be hiring full-time employees, that they are to make the county aware of that situation, so we can approve that. If it's 2, 3, 4 years out, then we can approve that. That is the situation that came up in May and June, that we were not fully informed of what was going on, and we want to make sure that that we're just doing our due diligence and making sure we're keeping up with the money.
We have to say language in there that covers that.
Item 14, the county shall approve all grant applications that involve the increase of staffing, expansion of facilities, or otherwise create additional future financial obligations. So it's pretty much word for word.
And as Pat was stating, we are the board of directors for that MA fire district. Each volunteer fire department has their own board of directors, and so we're it for them, so we've got to advocate for that area again. One question, actually, I've got back to number 12.
Yes, sir.
You stated that the old language said the fire department shall maintain a minimum public protection classification of 6 for Marion area, and they added the phrase shall use its best efforts. Okay. Now that would affect the people in that district. If that rate would go up, it would go to a 9, right? Go straight to a 9, and that would impact them specifically. For my take on it, I want to leave the language, the fire department shall maintain a minimum public protection classification 6. Here's why I say that. Because with additional staff they've got, they were talking about how it's going to even possibly reduce that rate. So, and how the additional staff, which will enable response to the other departments. I think that's important that they maintain the 6 and even go better. I mean, for my take on it, I think that language ought to remain the way it was prior.
Consensus, yes.
Well, we need to take that back here and make sure that is
We shall keep it.
in the language.
I can do that, and then make sure, I'm not going to text them right now and make sure. I know they would need to talk, but I can bring it back and just, if that's a sword fall sort of
We
moment.
can vote on it based on
Right.
that.
For the individual homeowner, it's going to be substantial as far as homeowner insurance if it goes from a 6 to a 9, and we need to have that. We need to have that for sure.
In fact, you're speaking from the former background of writing
Insurance.
policy.
Absolutely.
Yes, sir.
So what's the vote more than that?
I'd like for the staff to get with the, and make sure that that verbiage is what we're asking.
Is that a motion?
That is a motion.
Second.
There's a motion, so, and then other discussion. All in favor, say aye.
Aye.
Okay, thank you, sir.
Sure, thank you.
Next on the agenda is D, the opioid settlement update.
Thank you. A couple of months ago, we had on the agenda for the first time, I guess, a memorandum of agreement that had been established through a lot of effort between the North Carolina Association of County Commissioners and the North Carolina Attorney General. The idea being that there's strength in numbers, and if everyone's working off the same playbook, I guess. And so what's been established is a very lengthy document that's attached, but the idea would be that every county in the state is operating under the same understanding of how these monies could be spent. And so which would help us, it would help Association of County Commissioners, it would help funding entities that might be like a Gateway or someone else that might want to come along with this to understand what our focus areas would be.
Mr. Wood, what's the position of Association of County Commissioners?
They are advocating strongly that you pass this MOA.
Out of 100 counties, how many counties?
There's about 19 that have not. And so some of that was caution. I don't know that Mr. Coates is here, but attorneys tend to be very cautious, which is a great thing. But I did speak with him, I believe, Wednesday, and he saw no reason not to go ahead and sign this MOA.
Mr. Chair, make a motion to approve the memorandum of agreement.
Second. Motion second, discussion. All in favor, say aye.
Aye.
Any opposed?
Thank you.
Okay. Next, item E, the Stacy Hill Water Project, Ms. Wood.
Thank you. A couple of months ago, you authorized the advertisement of construction of a very short but very important connection to connect an existing water line at Stacy Hill Road to a water line on US 70. Those bids were opened a little over a week ago. The bid tab you see there, page 104, and so staff requests that those bids be entered into the minutes and that the low bid be awarded to T.P. Howard Plumbing Company of a bid of $104,000. And I will note that this will be paid for out of the American Rescue Plan.
Make a motion to accept as presented.
Second.
Motion second. Any discussion?
How many years has this one little stretch been discussed, actually?
We've had plans essentially sit on the shelf for about 2.5 years.
And then the people who, they've got some failing wells and that kind of thing.
This is an area where we're having to put water on the ground because we like that connection. So this is going to save the system some money. Absolutely.
Going back to what we talked about earlier, that 50,000 that you had set aside, that you set aside, possibly for those that were low income having problems getting water connection for their own question.
Oh, absolutely.
So that's taken care of. Okay, we have a motion second, and any more discussion? All in favor of this, say aye.
Aye.
Any opposed?
Thank you.
Okay, new business item A, administrative item, Mr. Wood.
Thank you. We have 4 items. The first, the town of Old Fort has sent the attached letter asking for your participation in their efforts to improve their Christmas decorations. They're asking for $2,500 for this project. You see the mayor's letter in the attachment.
Mr. Chairman, I'll just say this, that we support the city and the town, and if we spent $2,500 for a swag across Main Street for the city to enjoy and people driving through the city, I think it's only fair we spend $2,500 for the town of Old Fort to help them purchase Christmas decorations also.
So motion.
I'll make a motion.
Second. Motion second, all in favor? Any discussion? All in favor, say aye.
We don't want to create any ill will on that.
Absolutely, absolutely. I'm a native for it.
Especially with Christmas coming up, we don't be called Grinches.
Okay, the next item, we have 3 vehicles asking for approval of the financing. They're all Fords, so I know
I make a motion, since all boards go ahead and approve it right now, as presented. Strike the clause just off for it.
I just had to look at the motion and second, we have any discussion. All in favor, say aye.
Aye.
Any opposed?
Thank you. The next item, you have a memo from the sheriff where they lost a canine recently named Jazz, and there's been a request that the badge be donated to Lieutenant Stevenson, who was her handler and partner, I guess.
Make that motion as presented.
Got a motion and a second, any discussion on that? I think it's a good idea. All in favor, say aye.
Aye.
Any opposed?
Thank you. The last item under administrative items, the finance department has presented a memo. There's a gentleman who has an account in the solid waste department where it was delinquent, and the delinquent charges added up over $4,000. The gentleman has committed to pay the principal of a little over $4,600 if the interest is waived.
I'll make a motion we approve this because this was going to be a charge off of the total amount at one point, and staff did a good job in making contact, and they're going to save us $49 or whatever it is. So I'll make that motion.
Okay, any discussion?
Is there any way that we could prevent somebody from running up a bill like that in the future so that we don't have the same situation?
I think that was a very unusual situation where the individual had a business and had kind of gone out of business. It was a little hard for us to not necessarily track them down, but deal with the delinquent account to where we have a business account. Usually it's a lot easier to track. So it was I would say it's a unique situation.
Other than tax matters?
Was there a vote on that?
That's it.
Was there a vote on the write-off?
I thought we did. There was consensus. Was there motion discussion on the motion second? All in favor, say aye.
Aye.
Okay. Excuse me on that.
Tax matters, you have the typical tax releases refunds. I'd ask your approval. If you'd like to do that, then I'll mention the
Mr.
information.
Chair, make a motion we approve and that's presented.
The motion second, any discussion? All in favor, say aye. Aye.
Thank you. Last month, you asked information on the property tax discount that is granted if payments are made in July and August. So you have, get down to it, you have a memo from Ms. Hassani on page 126. We tend to look at our quartile, our population group, for just for comparison's sake a lot of times. And so you have a breakdown on page 127 of counties that still do a discount. And if you looked at this 10 or 15 years ago, probably all of these counties would have offered a discount, probably at much higher percentages. But it's become rarer and rarer. You do see a handful at 2% still, but quite a few are at 0 for their discount. And so this is informational. You asked for if there was any direction or questions about it.
What's the recommendation by staff?
Ms. Onufray noted that it can be challenging for when they have prepayments or refunds to calculate the discounts. But beyond that, I'm not sure we're able to make a recommendation for or against it.
That's what you're paid to do. Advise us.
It's honestly a political decision.
Well, I make a motion we do it because staff says that it's more obsolete now is what you're saying.
Based on what we've
Status
said.
compared with other counties.
What's the motion?
The motion is to take Linda Onufray's recommendation, statement that counties are moving away from doing gas now, and it's hard to build, according to Mr. Ruth, right?
The challenge comes into prepayments and refunds. So it adds more administrative effort.
So we got a motion, we have a second. Discussion. I'm gonna vote against it because I just absolutely don't want to take away that chance that they, the citizens might have of saving just a little bit on the property taxes by paying them early. So, all in favor for it, say aye. Aye. All opposed? Aye. 3-2 opposed. Okay, let's vote it down.
Thank you.
Next on the agenda, the Drexel side update, Mr. Gurney.
Yes, sir. The city of Marion is a co-owner of the Drexel site with the county. And the next item we'll talk about, we work in partnership as well. This item, the city has taken the lead on seeking out grants and administering those grants for that site. And so the city's identified an EPA grant that would provide additional funds to help the further cleaning of that site. There's some underground storage tanks and a few other things that still need to be removed. And so they have a grant of $500,000. It does require a matching local grant, local match of $100,000. The city has voted to commit $50,000 and they're asking for the county to match.
Mr. Chair, I make a motion to approve the match because we've got to get that site cleaned up in order to market it and move it on out.
A motion and second, any discussion? All in favor of that, say aye. Aye. Any opposed? Okay, item D, board appointments, that has been postponed.
The golden.
Golden leaf, D.
Okay, the golden leaf.
This item is mostly city property, but there is some county property that will probably be involved. And like I said, this is a partnership we have with the city of Marion to develop the area off of College Drive on the Universal property. And so like they have taken the lead on seeking out grants there. MEDA and the county have taken the lead in that order of working on grants for site development, et cetera, down there. Golden Leaf has a program called SITE, S-I-T-E, which doesn't stand for anything actually, but there's at least a $750,000 grant Mr. Abernathy and his staff and others are working on. The maximum is $1 million, and it may be in that range. It's due in 3 days, and there's a lot of effort already on it. We do want to get your blessing on it, though. There is no county match.
Clear the boards.
Make a motion to approve.
A motion and a second, any discussion? All in favor, say aye. Aye. Any opposed?
Thank you.
Okay, now, we need to vote on those taking this board appointments.
I think you
We've already
did. I think you tabled it, so that's okay.
We'll move on down to citizen comments. Is there anybody here that wishes to speak to the board tonight? If so, please come up and sign in. Madam Clerk. None on the left, none on the right. Okay, moving on. Commissioner staff reports.
All I'll mention, give a little bit of a preview for the November meeting. You will have the two development, the planning board and the subdivision ordinance on the agenda based on your action tonight. also have Dr. Merritt from the community college coming to give an update. They have 2 large grants that have been awarded, and also the Old Fort site that I'm sure you'd be willing or wanting to hear about. So, and there will be a lot more, but those are 2 that we definitely know will be next month.
Good. Next is the Historic Carson House, and we have Mr. Chuck Abernathy with us tonight. So, Chuck, we are going to give the floor to you.
Thank you and welcome to the Historic Carson House. Martha, you want to start off?
Welcome. Thank you so much for all your support that you have, and it's just a wonderful evening. Isn't it perfect now?
It is.
But thank you for coming. I'd like to take just a moment to introduce our board. Of course, you know, everyone knows Chuck, our board chairman. And if the members of the board would please stand when I call your name. Doug Swain, our vice chairman. Jesse Merritt. Karen Dark. Alice Stecker. And Dr. Jim Haney, and he's making a round around the grounds right now. But one of the quick things that I just wanted to share with you that has happened since we last met was I was so proud of being able to do a partnership with McDowell High School and have the students from the masonry and carpentry class come out and perform some. It was a learning experience for them, but it really helped us out tremendously. So I'm really proud of that partnership that we had. And of course, we just finished up with the Over Mountain Victory Trails here for a couple of days, and we hope we get to have public schools back this coming year. We did entertain some mentally challenged adults to come do living history, and also all of New Manna Christian School, elementary school, which that day we had 150 plus with adults out for that event. So again, welcome, and we're so happy that we're able to have a space that is useful to the county and be of service to the community.
Let's give Martha and the staff a hand.
Mr. Chairman, I did ask Jim Haney to lead in prayer.
Yes, absolutely.
When you're ready to eat, if that's okay with you.
We expect that every year.
Well, a couple of real quick comments. Financially, we're doing okay. We owe that a whole lot to your keeping us funded at the same level, and we greatly appreciate it. Nonprofits that shut their doors have difficulty keeping things going, and we're doing okay there. The Board of Commissioners have met here, Cheryl reminded me now, for 30 years. The first meeting was in August, and it was a little warm, and so they moved it to the fall. So this is the 30th anniversary of doing that. Why do you meet here? The house was built in 1793, and in 1843 and 4, the first meeting was held here of what was called the Court of Pleas and Quarter Sessions, which was the forerunner of the county commissioners. And so they met here for days and worked out a lot of detail and a lot of business that was conducted. And they met right in that house. A couple of things that they did that maybe people don't know about, and I'll be real quick. But there was a report made to the board about where to locate the city of Marion, and there were 3 sites that were discussed, and we're not real clear where all 3 of the sites were, except of course the one, which is where it's located. But one of the sites was on Buck Creek, and so that you've got Buck Creek right here. The guess would be north, maybe on Lake Tahoma Road, somewhere in that area. And another site was on what's called Bynum's Crossing, which is where, to the best that we know, where Sugar Hill Road and I-40 intersect. So the first fairly sizable conflict, it wasn't between the city and the county, because the city wasn't in existence yet, but over a city matter was over that location. And the location, the favored location actually was here. And there were people that did not want it located near this plantation because of the effect that it would have on the enslaved people, or the perceived idea that it would be an impact. And that's in the record. That's one. Second thing, the town was divided into 90 lots, and the lots were auctioned, and that happened in 1845, and they ranged in price from about $50 to $600 for the various lots. The money that was collected off the sale of those lots was, by statute, dedicated to the construction of the courthouse. And so the courthouse, you can imagine, you're talking about just a field with woods. There was nothing here. And so they laid out the roads, they built the courthouse, and there was actually a statute introduced about 3 or 4 years later that took excess funds and returned them to the county from that. So the courthouse came in under budget. So it's just a little bit of fun. If it's okay, Doug Swain is going to make a quick presentation to you about something that we have planned. Okay. So thank you, welcome, appreciate it.
Hi, Doug. Howdy, good to see you. I join Chuck and Martha in welcoming you here. Of course, since the earliest days, this has been a very public place. It was a roadside inn. It was the home of a family that was very involved in local politics. And then, of course, it was the seat of government after the county was formed. So we always love to open the doors to the public and to you folks in particular. 10 years ago, we did some long-range planning for the Carson House. And what we came up with at that time was that at the top of our wish list was that we should have a visitor center. If you think of your own experience visiting historic sites, whether it's Mount Vernon, the Vance birthplace up in Buncombe County, they all have visitor centers to support the operation of the historic property. And we agreed that that would help us do what we try to do here. But at the time, 10 years ago, we decided we couldn't afford to take that on. And so instead, we built the Arbor. And we're awfully glad that we did. This structure proves its utility just about every day. And besides all of the public gatherings that are here, as you probably know, it supports a booming wedding business that creates some income that supports the house. So we're doing very well by the Arbor. The last 10 years have been good for us. Over the last 6 or 7 years, we've received 2 sizable gifts. And in large part because of that, and because of your support, your ongoing support, we have decided that we're ready to take on the project of building the visitor center. So this past spring, we put together a committee that retraced some of the ground that our committee had, our long-range planning committee had covered 10 years ago. And we confirmed a lot of the decisions that were made at that time. And I'm gonna show you a rendering of this is kind of a conceptual plan for the visitor center that we hope to construct out here within the next couple of years.
Sure, yeah.
the 1850s and about 1910, there was an L on the back of the house. Prior to that, there was probably a detached kitchen, other outbuildings immediately behind the house. But we know that between the 1850s and 1910, about 1910, there was a two-story L behind the house. There's no trace of that now, but when we were doing the planning 10 years ago, and again when we were thinking about it this spring, we decided that we would do the visitor center in a way that it evoked that L that had been on the house. In large part, our plan to do that is for operational reasons. Although we're in much better financial condition than we have ever been, we still try to operate this place. We want to operate this place very conservatively, and if we put a visitor center somewhere else on the property, that would mean additional staff. And so our plan is to do it immediately behind the house. The plan is to build about a 2,200 square foot structure. It will include a reception area, gift shop, restrooms, proper restrooms. Right now we've just got the one small toilet bathroom in the house. It would include exhibit space, a couple of permanent exhibits, a space for rotating exhibits, offices for our staff, and a meeting room, library and archives, a kitchenette, and storage. So about 2,200 square feet. We have committed to, we're working out a financing plan for how we'll do this. Until we design it, put it out for bids, we won't know exactly how much it costs. We've got a ballpark figure in mind. We're working on a financing plan now. We would devote some of the money that has been gifted to us to that, kind of make a down payment, but we would look for other funding sources as well, including support from you folks. This is our expansion plan right now, our expansion project, but you can imagine with a place like this, there are always other things that we have to spend money on, big maintenance projects. We need a new roof. We're working on the caretaker's cottage behind us here to make that a useful structure to us again. And we've identified what we think are, it's at least $1 million, probably between $1 million and $1.5 million in projects that we will need to take on within the next couple of years. So that's exciting to us. We feel extremely fortunate that, again, because of your support and because of the significant gifts that we've received from members of the community and Carson descendants, that we'll be able to take on this big project in the future. One other thing worth mentioning is that from the beginning of our operating this place as a house museum, there's been the question of, are we a general purpose county museum? And we're not. We don't try to do that here because we have the house that we have to deal with. So everything kind of comes out from the house. For a long time, as you're aware, the plan was to put a general county museum in the Joseph McDowell House. That was the plan. That was the solution to that question. Where's our county museum going to be? My understanding, our understanding, is that with the engineering report on the Joseph McDowell House that says it's not safe to occupy the building unless you spend an awful lot of money just kind of rebuilding it, that's off the table right now. So the questions looms again, what are we going to do about a general McDowell County History Museum? We want to talk to you about that in the future. Right now, we're focused on getting the interpretive center project done. That'll occupy us for a couple of years at least, but we think of ourselves as about the only viable, ongoing historical entity in the county right now, and we want to work with you in the future to help get a general county museum built so we can talk about that on down the road. All right?
Sounds good.
Any questions?
Thank you very much, Doug.
Yes, sir.
Enjoyed that presentation. Next, I'd like to recognize a very special person, Mr. Jim Haney. Is he sitting here somewhere?
Oh, he's in the break.
Mr. Haney, are you, would you come forward and do a prayer of dismissal for us and bless the food that we're going to have tonight?
Let us pray. O God, our health and ages past, and our hope for years to come, we offer you thanks for the wisdom and virtuous traditions we have received from those who have gone before us. Inspire us in these days in faith, hope, and love, and give us the grace to conserve all that is good and worthy for the betterment and the enlightenment of those who will shape our future. Now, by your grace, bless all who are gathered here, together with the food and drink which we receive from your bounty through Jesus Christ our Lord. Amen.
Amen. Thank you, Mr. Grant. If any of you have never had the opportunity to do a tour of the Carson House, he's a great person to take you on one. He took me on one, and I really enjoyed it.
Mr. Chairman, it's sort of our custom when we come to this meeting every year as a board. The Carson House board so graciously has a meal for us. But in light of them being a nonprofit who have got some big plans here, I'd like to make a motion that the board take care of paying for the meal tonight to save them some money.
Second.
Motion and second. All in favor, say aye. Aye. Thank you very much. Do I hear a motion we adjourn?
Second.
Second. All in favor, say aye.
Aye.
We are adjourned. Thank you very much.